Happy Hump Day, everyone. Today we're going to continue our series on common fetal ultrasound markers. Last time we talked about the echogenic intracardiac focus. Today we're going to talk about the choroid plexus cyst. For those of you who don't know me, my name is Dr. Heather Stanley Christian. I'm the director of Unity Maternal Fetal Medicine. And hopefully by the end of this, I'll be able to help you understand a little bit about a finding that perhaps your provider, your sonographer, or your doctor may have shared with you. So, what exactly is a choroid plexus cyst? Let me define what choroid plexus is. It's a conglomeration of capillaries that lines the ventricles in our brain. Our brain is buffered by cerebrospinal fluid, otherwise known as CSF, and that fluid is actually produced by the conglomeration of the choroid plexus. That is one of the main function of the choroid plexus. Once the CSF is in the space, it's reabsorbed and there's a balance to it. So a choroid plexus cyst is really a small fluid-filled structure within those tiny capillaries of the choroids in the lateral ventricles of the brain. On ultrasound, to refresh, anything that's fluid or blood appears black on ultrasound, and anything that's bright and dense appears bright. And so these cysts are echolucent or dark cysts that you can see within the echogenic or the brighter choroids. A choroid plexus cyst is not considered a structural or a functional brain anomaly. So I would liken a choroid plexus cyst as a blister, like a blister on the skin or a zit, and it's not a brain abnormality. It's just an accumulation of production of a naturally occurring spinal fluid within the center of the cells that actually make the fluid. So then why are we concerned about it? Lots of years back, actually, there was a thought that there was some association between an choroid plexus cyst and a possible fetal problem, such as trisomy 18. But we do know that when a baby or a fetus is affected by trisomy 18, we can, not always, but we can see multiple other structurally anomalies that's always seen. Most commonly, heart defects, clenched hands, clubbed feet, growth restriction, and plus or minus polyhydramnios. So if all that's seen is an isolated choroid plexus cyst with no other findings, usually we can breathe a sigh of relief. So what can be done about a choroid plexus cyst? Actually, nothing needs to be done about it because invariably by the third trimester, it has reabsorbed and will no longer be seen on ultrasound. However, if we do identify a cyst on ultrasound, the next step is to do a detailed ultrasound to look at other structural defects, as I just said. So, what if you had an ultrasound? You had a screen such as an NIPS, NIPT, first trimester screen, and it came back as a low risk for the usual trisomies. That's 13, 18, or 21. But you went for your ultrasound and they saw an isolated CP cyst. What do? We don't need to do anything. If your NIPS is low risk and the baby's growth is good, detailed ultrasound showed that the heart structures are normal, the hands are not clenched, there's no evidence of club foot or clubbed feet, because it can be bilateral, then it's an isolated cyst and does not require any follow-up. Now, what if you had a quad screen? That's usually done between 15 to 18 weeks. And the quad screen showed an increased risk with an isolated cyst. What should be done is a detailed ultrasound looking at the aforementioned things. And if there's no evidence of any other structural defects, then no further follow-up is needed. An amniocentesis is not usually indicated unless there is or there are one or more findings on the ultrasound. If you have a non-invasive prenatal screen, that's low risk for trisomy 18, and the choroid plexus is the only thing that's seen, you can breathe a sigh of relief. If, however, there is a choroid plexus cyst plus any other findings, regardless of the screen results, then I do recommend strongly that genetic counseling is obtained. And from there, a plan can be provided. So to summarize this, a choroid plexus cyst is just an accumulation of fluid within the natural choroid plexus that produces CSF. It has been used in the past as a marker that's been to assess the risk of trisomy 18. If an isolated choroid plexus cyst is seen, a deep dive using a detailed ultrasound should be done to assess for other potential abnormalities that may be present. If it is isolated, if the choroid plexus is an isolated finding and the NIPS, your non-invasive prenatal screen, is a low risk, then you can consider that normal and not to worry. Any other findings should be followed up by either a genetic counselor or an MFM specialist such as myself. I hope that this can help at least someone out there to breathe a little easier. If you have any questions, if you'd like to schedule a telehealth, shoot us an email. Our brick and mortar office is in Claremont, Florida. That's in the Orlando and surrounding regions. We are at 17323 Pagonia Road, Suite 227. You can always give us a call. Someone will answer the phone or get back to you within a couple hours. You can leave us a message on Google Business. And if we can help in any way, we're happy to do so by telemedicine or in your physical appearance. So once again, just stopping by for Knowledge Day. Want us to have a wonderful rest of the day. And I'll talk to you next week. Bye.